You may have come across completely opposite advice when searching for reliefs from your lower back or hip pain, and that can leave you genuinely confused about where to even begin. If you have been trying stretching and the relief has not been lasting, it might be worth considering whether stretching is the full answer to your situation. In this video, I want to help you cut through the confusion, understand what your body is asking for, and find the right entry point to break the pain cycle. Stretching can absolutely help with lower back and hip pain. And when it is the right fit, the relief is real. When muscle has become shorter than it should be, stretching brings it back towards a neutral resting length. It is a length where it can both contract and lengthen freely. That is when stretching works. But a tight muscle is not always a short muscle. A muscle can also feel tight when it has been in an overstretched position for so long, and it has lost its ability to come back to neutral. So, if you stretch a muscle that is already in that stretched situation, you may feel some temporary relief, but you are not addressing what it actually needs. So, the question is not whether stretching is good or bad, it is whether it is the right thing for this situation at this moment. What I'm going to walk you through now are not steps to follow in a set order. They are different entry points for different situations. As we go through each one, I want you to notice that what resonates with your own experience. That is how you find the right one for your body. If your body tends to feel tight or tense regardless of what you do physically, maybe after a stressful day, the body feels wound up and difficult to settle, then creating safety and relaxation in the body is crucial. When I say safety, I don't just mean physical danger. What I mean is the states the nerve system is in. Because you could be in a safe environment, but your body is not able to feel safe and relax. Let me explain why. There is a state of safety where the body is relaxed and open, and there is a activated state where the body is on guard so that we can be ready to the tasks. The part of the brain that manages this operates below our conscious awareness, and the signal that triggers these activated states are not always from physical danger. They come from the pressure and the demands of our daily life, such as a stressful day, full schedule, or constantly rushing. Our breathing becomes shallower and our heart beats faster. So the brain picks up those signals and responds as if there is something we need to get ready for or consider it a threat. So, under these states, the body holds tension. And if we do not consciously signal that the pressure has passed, that tension keeps building up and it builds up quietly without us even realizing it. So, how can we tell the body to release unnecessary tension? The most accessible tool to help the body feel safe and open is breathing. So, breathing deeply and slowly can physically create more space inside the body through expansion. And when there is more space inside, the muscle has more room to stretch, to relax, to engage. With that in mind, let's take a moment to check in. How tight does your body feel right now? And are you having a stressful day? We're going to practice breathing for about 10 times so that you can have experience. Wherever you are, make sure your upper body is straight on top of your pelvis. And you can do this with your eyes open, but if you feel comfortable, feel free to close your eyes or soften your gaze and pay attention to my verbal instruction. If the environment is okay, put one hand on your chest and one hand on your belly. And on your next inhale, focus on the expansion of your rib cage at the front. And you will feel both of your hands slightly rise up. And as you exhale, you will feel both hands slightly drop close to the spine. So inhale, expand the front of your rib cage. Hands rise up and exhale, hands slightly drop. And now let's put our hands on the side of the rib cage. You can hug yourself and take a full breath in and feel the expansion on the side of your body. And exhale, soften so hands will draw slightly closer to the spine. Inhale, expand the side of your rib cage. And exhale, hands drop slightly close to the rib cage. And now let's put the hands down and just put one hand at the back of your body. If this is not so comfortable, you can relax both of your hands on your thigh. That's not a problem. So on your next inhale, focus on the expansion at the back because your rib cage or the lung is not just the front or the side. So you may feel there's a lot of movement, or you may not feel much because it's a slightly difficult part of the body to be aware. So, whatever is your experience is okay. It's good to know. And slowly, gently open your eyes if you have them closed. Now, let's take a moment to check in again. Do you feel slightly more relaxed? If you did, this is how breathing can help you release stress or tension in the body. And if you didn't, that's okay too. It doesn't mean you did anything wrong. It means it could take a longer period of deep breathing for you to feel that relaxation in the body. But for the time being of this video, let's move on to the next point. If you notice tightness or restriction in certain areas, or if there is a clear difference between left and right when you stand upright, then the second entry point, opening up space, could be beneficial for you. And to find where the space is needed, we need to check the structure. What we're looking for are signs that the body has adapted into a noticeably asymmetry. So from the front view, we may see one hip may sit slightly higher than the other. And from the side, the pelvis has tilted in a way that either it creates a excessive curve at the lower back or a flattened curve at the lower back. When these patterns are present, it means certain areas of the muscles have been shortened and compressed, and that's where the space needs to be created. Stretching is one of the most effective strategies to create that space. A common example, especially for people who spend a lot of time sitting, is the hip flexor muscles. So these muscles will help you bring your legs forward and up. When we spend a long period of time sitting, the hip flexor stays shortened for hours at a time. And over time, they lose the ability to return to their neutral length, and they will pull the pelvis forward and creating compression in the lower back. To stretch the hip flexor, what we can do is come to 90 and 90 on the floor. And I like to test water because my body doesn't show up the same way every day. So I will see how much room I have here. I will find a position that allows me to feel the right amount of stretch, which is not too little and it's not too much. So then I will adjust my front leg and make sure that the heel is under the knee. And as I hold here, I'm going to breathe fully to expand my lung. And exhale, as I exhale, you see space already open up and I can go slightly lower. So this is how breathing together with the stretch can be beneficial. Stretching is a big topic with a lot of details: how to stretch, when to stretch, and which type suits your body and your situation. All of them makes a real difference to how effective it is. If that is something you would like me to go deeper on, comment stretch below or hit the like button. It helps me to know what to create in the future. If you have been stretching or going through treatment, the relief feels good in the moment, but it doesn't last. Or if you find one side of your body feels noticeably weaker or less stable during everyday movement, if any of this feels familiar, adding strengthening on top of stretching could be what the body is asking for. Stretching creates space, but without the strength to hold that space, the body drifts back. Using the same example, the hip flexor can release through stretching, but if the glute is not trained to engage or support the pelvis, the new position will not hold. Strengthening is what gives the body the capacity to stay there. A simple and effective way to reactivate the glutes is bridge. Let's give it a try together. Now let's come down to your mat and your foot is hip distance apart. And also the foot is not too close to the glute. It's slightly away so that when you push into bridge, the knee will be on top of the heel. And with that in mind, we could start from neutral position, which is lying down and knee up. And take a full breath in. As you exhale, we engage the core and feel the bottom of your foot and push evenly between 2 foot and squeeze your glute and then drive your hips up. And as you gently release the glute, gradually your hip will come down to the mat. So we squeeze, push through the foot and squeeze the glute to get into bridge. And now gradually release the glute and get back down. If you notice that certain movement brings up a strong resistance, fearful thoughts, anxious feelings, or other emotions that makes it hard to carry forward, paying attention to the mind and body connection could make a real difference. Those thoughts and feelings are natural. The goal is not to get rid of them or push through them. We have a choice in how we respond. And one of them is to stay curious, to acknowledge what is there and take care of it rather than fight against it. So, how do we take care of those uncomfortable thoughts and emotions? I'll use glute bridge as example. And if you have felt lower back pain while doing the bridge, it is likely you will feel resistant or you'll have anxious thoughts showing up before you even begin. And let me get on the mat and show you what we can do. So I'm about to do a bridge and I had pain before. So it's likely I will have thoughts about, "Oh, I hope I don't feel pain this time." And that's very natural. And I would catch myself. This, I can use it as a trigger point for me to check in with my body before I move. And let's say I'm pushing towards not even all the way up, somewhere that I start to feel some sort of discomfort or some sort of sensation that you feel like this is doesn't feel good. That is okay. We will stop here. We do not want to push into pain. We want to stop before that happens so that we can build the body and mind connection that yes, I have fearful thoughts, but I'm taking care of myself. And I am moving however much capacity I have right now. So the brain doesn't go panic whenever you move. Even though I'm not moving all the way up, I am moving slightly, but I have no pain. And this will help to rebuild the body and mind connection and rebuild the trust among them. And with that, over and over by practice, your body will start to let go even more or build strength. And you may open up new space or open up more capacity to eventually become stronger and push it all the way up. Whichever these four layers resonated most with you, that is where your body is asking for attention. Knowing what to work on is a powerful starting point, but breaking an old pattern and replace it with a new one takes time. And what makes that possible is not willpower. It is practicing in a way that the body notices a difference, in a way where coming back feels natural rather than forced. In the next video, I'll walk you through how to pay attention during your practice so that you can get the most out of the time you put in. And if you would like to understand more about finding the hidden pattern that contributes to your pain, I covered it in details in this video on your screen right now.